Well, hello, everybody. I'm going to be talking about patient advocacy, a how-to guide. And I think it's really important to consider being a patient advocate, a volunteer, because sarcomas are rare cancers. And if we don't raise awareness of it by speaking up, then it's just going to be lost in the world of knowledge and support and research. And in particular, I'm very fond of doing advocacy work for childhood cancers because they also are rare and children can't advocate for themselves. So it's up to us to do it for people who can't advocate for themselves. So what is a patient advocate? Well, anyone who works to improve the conditions for people who are or have been patients or even future patients is a patient advocate. Some healthcare providers are patient advocates because they work very hard to get insurance to cover treatment. They try to develop new treatments, but many are volunteers. And I've been a patient advocate volunteer for many years. For example, the Sarcoma Alliance relies on volunteers to accomplish our missions of education, guidance, and support. We couldn't put on a conference like this and educate people without our many volunteers. If you like, you could be a volunteer too. So how do you become a patient volunteer, an advocate? Well, do you have a connection to sarcoma? You probably are if you're on this conference. My own personal connection is that exactly 25 years and 3 days ago, I first heard the word sarcoma. My daughter was diagnosed with alveolar rhabdomyosarcoma when she was 13. And I'm happy to say that she's been cancer-free for 25 years, so that's been good. But I'm sure all of you have some connection to sarcoma. No particular skills are needed. I do have a PhD in biology, but I do a lot of my work. It doesn't require having that kind of experience, and we'll go into some of the areas that you can do later. One thing that I do want to emphasize is make sure that you are ready to do it, because it can be very difficult. You can learn a lot, but you can also be stressed out or sometimes even sad when you find out about what's going on in the world of advocacy. Don't start until you feel that you are up to it. I didn't start until about 4 years after my daughter finished treatment. And it took me that long to really feel as though I was up to being able to help others with sarcoma. So let's see, do something that's rewarding to you. And everybody will have something that they particularly feel keen about. One of the things that I do is, because I have a background in biology, I can translate often between medicalese and English and help people understand some things about research or about clinical trials. So what type of patient advocacy suits you? There's not just one type, but there are quite actually several. Support advocacy is one thing. And actually, most of what the Sarcoma Alliance does is support advocacy. We have provide education and guidance material. Somebody has to develop that. We mentor others, especially with our partner Immerman Angels and peer-to-peer groups. We host support groups and conferences like this, and all of those things are support advocacy. Financial advocacy is another type of support. And actually, the Sarcoma Alliance does some of that too, because we provide second opinion grants to help defray costs of seeking second opinions. Raising money for nonprofits, including the Sarcoma Alliance, is an important part of financial advocacy, but there's other sorts of financial advocacy as well. For example, helping to get patients have coverage, insurance coverage for their treatment. Lobbying advocacy is something that you might think about, because that actually speaks out and raises awareness on a much more broad basis. We've had volunteers who have requested legislation to recognize July as Sarcoma Awareness Month in state legislatures and the federal government, for example. And then right now we do have a specialist referral initiative that is working to remove barriers to expert opinion. And that's something that you might be interested in helping with, especially if you have some connections in industry that might be affected, such as insurance. One of the things that we are not doing right now, but another example of lobbying advocacy, is that you may not be aware that there are state by state laws that restrict or regulate the ability to do telehealth with doctors in other states. And some of those regulations were eased for the pandemic, but many of them have been reinstated. And it's the sort of thing that would be useful to have an understanding that telehealth may be part of the future, and we need to keep that open. Research advocacy. That's something that in general, the Sarcoma Alliance doesn't do. We do provide information about clinical trials, but really that's the only kind of advocacy that we do. However, there are other opportunities. We have our sister organization, the Sarcoma Foundation of America, raises money for research. The Children's Oncology Group, which you've heard about a little bit, has patient advocates who help in the design and development of new treatments and clinical trials. The Connective Tissue Oncology Society also has patient advocates who do that. And then there's the Sarcoma Coalition, which is a group of nonprofits, including the Sarcoma Alliance, all of whom can advocate for improved research, especially raising money for more research. So how can you help support others with sarcoma? Well, there are a number of ways. For example, I'm going to be talking mostly about the Sarcoma Alliance, but all nonprofits probably need something. If you're interested in helping the Sarcoma Alliance, here's some suggestions. Marketing. We have the need to get the word out about our services. It always surprises me that not everybody knows that we offer grants for second opinion reimbursement of costs. It's really important for people to find out about that and to make use of that really important service. So if you have any connections in social media, if you're experienced with press releases, those kinds of things we could really help with. If you can even just institute Sarcoma Awareness Month activities, those sorts of things get the word out as well. It's easy enough to make a yard sign, for example, or I have pins on. A yellow sunflower pin here is a sarcoma one. A gold pin is a childhood cancer awareness month. If you wear a pin like this, people will ask you about it. If you put a yard sign in your yard, people will ask you about it, and you'll be surprised to find out that some other people may actually have a connection with sarcoma too. I was always amazed that if I wore my Sarcoma Alliance hat, somebody would come up to me and say, oh, my cousin had sarcoma. Well, we run on a shoestring. We have a very small staff. Almost all of the people working on putting together this exchange and our other services are volunteers. But just like other nonprofits, we need funds to help pay for what we do. And so there's lots of ways that you can raise money for us if that's the sort of thing you're interested in. You can hold an independent event or an online fundraiser, participate in walks. I want to give a shout out to our partner Wendy Walk. They have a walk coming up this month and are raising money for us that way. We have Ocean of Hope teams that raise money for us. Those are paddlers that cross open ocean, and they're always raising money for us as well. And there are many others. If you have an employer who might be interested in helping us, there can be employer matches. We have Amazon Smile account. If you buy anything on Amazon, and who doesn't, try doing it through our account. We even have a shop where we'll sell things. If you're looking for gifts for people that also raise awareness, you can get the pin with the yellow pin with the sunflower on it in our shop. So, but one of the things that I particularly would like to talk about are some of the programs and services. Alyssa later is going to talk about our new updated website. We always have a need for new content and for somebody to review the content that we have and see if anything is outdated and needs assistance. One of our new board members has started a blog on mental health, for example. That's an extremely important topic that we haven't covered before. Support groups. We have a huge Facebook online support group of over 11,000 people. We have volunteer managers who help run it and keep things running smoothly. We also have sponsor an in-person support group in Southern California. We will help you start a new in-person ones in your area if you need help with that. I mentioned the assistance fund before. We have volunteers who help review the applications and make sure that we have all the information that we need to be able to provide a grant. I mentioned Immerman Angels, mentoring. Those are peer-to-peer mentors. If we are always looking for people of specifically sarcoma subtypes for Immerman Angels matches. So if you're interested in partnering and maybe mentoring somebody peer-to-peer, we can provide information on how to do that. And then one of the things that we do a lot of is implement in Sarcoma Awareness Month activities, and that's July. And it's really important to do that because, again, the more people that are aware of sarcoma, the more likely people are to get diagnosed early, not to ignore the lump that is getting bigger or the pain that will not go away, and just think that it might be actually a sarcoma and not just something that's non-life-threatening. And then, of course, we need assistance with our annual exchange. And this, every year we put this on. Every year it's been different so far. We've had, the first one was in person. The second one was sort of hybrid. The third one was remote. And this one is remote as well. Hopefully next year we will go back to being a hybrid one. But it takes a lot of volunteer hours to be able to get this put on. And then if you have any special skill sets, we can always use some administration help. If you're good at IT, if you have accounting skills, we might have some tasks that you could help us with. So how to do it? It's easy. We have a lot of information on our website. You can look and see what sorts of things you'd like to do. You can contact us easily at the Sarcoma Alliance, our info page, or you can contact Executive Director Alyssa O'Driscoll directly. I've given all this information here. And with that, I'd just like to thank everybody who's put all the time and effort into making this exchange happen. We couldn't do it without our sponsors, and we certainly couldn't do it without the volunteer members of our task force. And with that, if anybody has any questions about volunteering, I'd be more than happy to answer them.